Good afternoon, ladies and gentlemen across our beautiful country of Canada, our friends around the world, in the known and unknown universe. Welcome back to your favorite Angry Canadian on the 13th day of February 2024. Am I pissed? I've done a video about this already, but stuff keeps coming out about what we were forced into taking not we. I am not vaccinated, I admit it. I'm 69 this year, overweight, heart issue, there's blood pressure, diabetes. I got a whole gauntlet of issues. I'm okay, but my son, working, had to be vaccinated to keep working. And he has had 4 blood clots last year, 1 in each leg and 2 in his lungs. It just like that, I don't even know. I'm just so friggin' furious at our killer government because that's what they have done. Where did they get the information to do these fast vaccinations? Fast, because that vaccine, well, maybe somebody had it in their back pocket, but it sure the hell came out quick. But it's a nasty incident in our history. And where's the media talking about it? Where's the opposition demanding inquiries, wanting to have numbers on how many people have been injured in Canada by the vaccination? Forced friggin' vaccination of Canadians.
Thank you for the efforts you're making to stay home, keep a safe distance from others, and protect our communities. What you do matters. You're helping to slow the spread of COVID-19. Please continue to help protect our loved ones, our elders, and our healthcare workers. And for children and youth, remember, this is not forever. This is just for now. Let's all be kind, be calm, and stay safe. Thank you for doing your part.
I can tell you why that biatch isn't fired. Because she does what the government tells her. Oh, she's a good little stooge. But, and there's unfortunately many other people out there like that. But on top of that, when it gets to the point that you can't trust your government to be honest with you, you got to figure that they pretty well dislike Canadians and don't give a shit about you.
First of all, the work that Health Canada is doing to ensure that this vaccine is every vaccine that is approved is safe for Canadians is uncompromising. There are no corners cut. There are measures put in place to ensure that any vaccine we distribute to Canadians will be safe for Canadians. Canadians can have confidence in our medical professionals, in our scientists, in our researchers who are doing everything they can to keep Canadians safe, both from this pandemic and from other challenges as we move forward. It is extremely important that support for scientists and doctors and health professionals and local public health authorities continues to be shared. And that's why it behooves every parliamentarian to stand up for science, to support the work of our experts who are working extremely hard to keep Canadians safe.
This piece of work sure uses a lot of words like science. Oh, yes, you got to trust science and experts. Oh, shit, man, look at the situation globally now. I mean, you got to trust the experts. Because look how great life is for everyone. Trust the experts, trust science, trust health authorities, trust everyone. And don't believe your friggin' eyes or people talking or whatever, because they're just disinformation spread.
Here in BC, we've made progress managing COVID-19 because we've worked together to flatten the curve. As we begin more activities, we must plan carefully to protect ourselves, our loved ones, and our communities. Let's keep up our safe physical distancing, wash our hands regularly, and if we feel sick, stay home, no exceptions. It's important that each of us stay vigilant, and as we move forward together, remember to be kind, be calm, and be safe.
How the hell are Canadians trusting this government, thinking that, boy, they're doing good for Canada, we should have him elected again? I mean, what, 30 something percent of Canadians support this piece of shit? And yeah, I call him a piece of shit. Look, we just got a report now from about a program the government was running to do with arrivals and passports and shit like that. I'll get to it in another video. But it was supposed to cost $80,000, this program. Listen, 80,000. Do you know how much it ended up costing? 60 million. From 80,000 to 60 million. Why aren't people let out the doors? Fired all over the place. That's just not even bullshit anymore. 80,000 to 60 million. I can't imagine what this debacle of the vaccinations, shutdowns, everything has cost, but I do know Canadian taxpayers will be on the hook for it. Oh, man.
We have secured, as you point out, one of the best ranges of vaccine portfolios of any country in the world, and we've secured more potential doses per Canadian than anywhere else. So we know that while it is important, and it is great news that we're starting to vaccinate now in December ahead of schedule, it is once we get a significant proportion of the population vaccinated that we will start to be able to look at loosening restrictions. The Americans have a healthcare system that will have challenges and will have successes. We have our own process. We're focused on our own process to make sure that as many Canadians as possible get vaccinated as quickly as possible with vaccines that are safe and effective and approved by Health Canada. We are, of course, watching approvals elsewhere around the world, but the decisions made as to what is right for Canadians and what is safe for Canadians will be done by the Canadian experts who are putting our safety first with a gold standard of approach that is the envy of the world. We will continue to focus every step of the way on delivering safe, effective vaccines for as many Canadians as possible as soon as possible.
Between our lying piece of crap politicians and government and the mainstream media being the enemy of Canada and Canadians, is it any wonder that people got the vaccinations? And then, to make sure they did, there were provinces offering beer and $100 and a lottery ticket and all kinds of promotions to get people to take the damn vaccine. Where's the investigation into that? Don't fall asleep.
Dr. Henry has been out front, guiding British Columbians with facts.
Colombia, the risk still remains very low.
Humor.
Wash your hands like you've been chopping jalapenos and you need to change your contacts.
And compassion.
I went through SARS. I've been through Ebola. I've been through the pandemic in 2009. And I just know how stressful it is for our healthcare system, for my colleagues, and for families.
Yesterday, she announced some significant changes.
We are advising British Columbians against all non-essential travel outside of Canada. We are directing all event organizers in British Columbia that they will be required to cancel any gatherings larger than 250 people.
CBC never fails to carry water for the government. There's no investigation on what happened, why, where. In the States, they look into stuff like gain of function research. Remember in the beginning they were saying it came from a pangolin and the bad and all this sort of stuff. They didn't know, and yet they forced Canadians and people around the world to get vaccinated. So how many people have died directly of government action? And I have to say, it's really sad that so many young people are dying. In the beginning, they said it's elderly, people with underlying conditions. Well, guess what? It changed. Isn't that something? Of course, the media is all over it. So are the politicians. They haven't even fucking apologized to Canadians or anywhere in the world. Apology. Not that it would do good.
Sudden death among healthy working age people worldwide is skyrocketing. Here in America, it was up 40% during the third and fourth quarters of 2021. Our next guest contends a 10% jump would have been a 1 in 200 year event, but this was 40%. Edward Dowd is a founding partner of Finance Technologies and author of the new book, Cause Unknown, The Epidemic of Sudden Deaths in 2021 and 2022. Okay, Edward, most people would respond to this sudden death news and say the statistics jumped 40% because of COVID-19. What do you say?
Yeah, so in 2020, it was mostly old folks who died of COVID with comorbidities. Then there was a sudden mix shift in 2021 and 22 and continues in 23. And my work and my partner's work points to something that happened with the employed of our country. It's been detrimental to your health to be employed in 21 and 22. And we examined the Society of Actuaries, which is an industry group for insurers that does surveys. In August of 22, they came out with a survey for their group life policyholders. And group life is a specific policy for those who onboard to Fortune 500 or mid-sized companies. You get this death benefit as kind of a freebie when you onboard, and you get 1 or 2 extra salary. Should you die, you get that. Your family gets that, or your beneficiary. You have to be employed at the time you get it. Well, this is a great business for insurance companies. And in 2021, the whole industry experienced 40% excess death in ages 25 through 64. The millennials, 25 through 44, were hard hit particularly. The group life policyholders generally die at 1/3 the rate of the general U.S. population in any given year. And in 2021, I just said they had 40% excess death. The general U.S. population had 32% excess death.
Well, it seems like, tell us about some of these unexpected sudden deaths. It seems like there are a lot of them. I mean, just from a Google search, you can find like a lot of 12, 14, 16, 18-year-olds that are just dropping dead suddenly. Tell us more.
Right. And in my book, I talk about sudden death, and we look at the sudden deaths of athletes, which, did it happen before 21? It did. There was a study in 2006 by the Lausanne Institute in Switzerland that showed over the course of 38 years, they found 1,101 sudden athletic deaths, which is about 29 a year globally. We'd be lucky to have a month with just 29 since 2021. In my book alone, there's hundreds and hundreds of examples. So something's changed.
She got her shot on November 4th, and she says she hasn't been the same since.
Immediately, within an hour, I had tingling down my arm, and by the time I got home, my vision was blurry and double.
But that wasn't all.
My sensitivity to sound and light had become so severe that I had to have earmuffs on all the time and sunglasses.
She says that's when things took a turn for the worse.
So I had this weeks-long neurological decline. Nobody knew what was going on. I called the test clinic several times. Finally, 2 days later, they had me come in and they did a neurological exam, and they said, "Oh, it looks like you have MS."
Her symptoms continued to worsen, and just before Thanksgiving, she says her legs stopped working, sending her to the ER. But after running several MRIs, CAT scans, and lumbar punctures, nothing.
I spent the next several months of my life trapped in my room by myself, completely alone and in silence. Even the sound of my husband's pants swishing was too much for my ears. We put towels on the windows, trying to make it darker. And it was a nightmare.
No answers, no relief, no hope.